Hello, James. I'm very honored to welcome you today to this first ever Global Health Dialogue. Today's discussion will be focused on global diabetes care with a view to get across some topics that currently matter most in the field. With the coming World Diabetes Day on the 14th of November, we wanted to use the opportunity to take stock of the dynamic of the global diabetes work in 2021, year of the centenary of the discovery of insulin. WHO launched the Global Diabetes Compact in April 2021, but what has actually happened since then to benefit people living with diabetes, especially in low and middle income countries?
Thanks, Annelise. So the launch of the compact during the year of the centenary year of the discovery of insulin is an important step in improving the care of people living with diabetes. Diabetes is a challenging disease affecting almost 500 million people around the world, with almost 80% of those living in lower income countries. The compact is a good opportunity to really increase the political focus in this area. Diabetes hasn't always received the political attention that's needed. And so we were really pleased as IFPMA to be part of the launch of the Global Compact in April, because the industry does make a very significant contribution to helping patients live with diabetes effectively. We have seen multi-sectoral partnerships moving rather slow in this area. The compact and other political focus can really help accelerate some of the progress that we all need to make towards improving the lives of patients living with diabetes.
What would you say people living with diabetes, and especially again in lower resource settings, need for an improved diabetes care?
So I think for all patients living with diabetes, actually they need a similar set of interventions and support. My friend living in the UK is able to access good primary care, a diagnosis of his disease very early, whereas in lower income settings, not all of those are in place. So patients may not be able to see a physician or a healthcare professional. There may be no or low level of awareness. There may be low levels of training for those professionals. There may not be the tests or the other medicines that are needed to help those patients manage their disease. And similarly, they may lack information, in fact. If they can't receive those, if they don't have access to materials online. And finally, there may be also a limited supply chain in terms of how prescriptions are delivered, how they would have to travel a long way to go and receive their latest medicines. And they may also not even have the storage that's needed for these quite complicated medicines.
Topic that is also widely discussed Tuesday is the uptake of digital tools as well for improving the prevention and the management of diabetes, and also its comorbidities, including the self-management of the condition, obviously, and also a way for strengthening the dialogue between healthcare professionals or community workers with people living with diabetes. And actually, this prevention angle is even more important for type 2 diabetes, obviously, as it can prevent people at risk of developing it. Talking of type 2, what do you think of the recent inclusion of SGLT2 inhibitors and analog insulin in the WHO essential medicines list?
So first of all, I really agree with you that the role of digital tools actually can make a massive difference. Again, using my friend as an example, he has over the last few years been able to benefit from a continual glucose monitoring system via an implant on his arm, and then the data goes to his phone. This has made a very significant difference. But again, it's available in a country like the UK with a national health system, but not available in many parts of the world. Now, when it comes to the role of the essential medicines list and the recent expansion beyond insulin, clearly this is a very important step that we would welcome, because type 2 diabetes is the majority of diabetes patients around the world. And indeed, we've been encouraging the expansion of the focus beyond just type 1 and beyond just insulin products to include some of the newer innovative products that are just added into the new essential medicines list.